Welcome to the Foot Health Facts Podcast, powered by the American College of Foot and Ankle Surgeons. I'm your host and a fellow of the college, Dr. Matthew Dairman. Today, we're kicking off a three-part series on one of the most common and commonly underestimated injuries out there, the ankle sprain. Joining me is Dr. Tyler Tewilliager, a foot and ankle surgeon in Houma, Louisiana. Tyler, welcome to the podcast.
Thanks for having me. Excited to be here.
Before we jump in, give us one fun fact about you that has absolutely nothing to do with feet.
Yeah, absolutely. So my fun fact is my fiance. So we are actually getting married in the end of October, 10/25/25 in Columbus, Ohio, where we met. And we've been together for about 4.5 years at this point, and super excited to get married and kind of go to the next chapter of our lives.
That's great. How active are you in the planning of the wedding?
She calls it my surprise party, so to tell you everything you need to know.
Yeah, this is the tux I want you to wear, and just show up at this time. Perfect.
Exactly.
Two favorite words in the English language for me: yes, dear.
Yeah,
so remember them. Love it. Okay, so let's get into ankle sprains. Let's start with the basics. What actually happens when someone sprains their ankle?
And so very common injury that we see in practice. It really is typically, most commonly, just a rolling of your foot to the inside where you are stretching out the ligaments and tendons on the outside of your ankle. That is like the most bread and butter ankle sprain we see. It is a spectrum, and we'll talk about that a little bit more, where, we see some tearing, complete rupture of some ligaments, but the most common thing I see in practice is a stretching of the ligaments on the outside, potential injury to the tendons.
So basically, when someone says they've rolled their ankle, they're talking more or less ankle sprain.
Yep, exactly.
Yeah. So we hear terms like grade 1 or high ankle sprain thrown around. What do those mean, and why should listeners care?
Yeah, so the spectrum of the injury is really the kind of most important thing when you're looking at treatment. Grade 1 are those stretching type injuries, whereas the grade 3 injury, kind of full blown on the other side of the spectrum, is where you have complete rupture of your ligaments, which can really cause some long-term instability if it's not addressed the right way. And when you're looking more at the high ankle sprains, these are a lot higher energy rotational injuries. See it a lot in athletes. And those are injuries that, unfortunately are prone to further instability down the line if they're not addressed appropriately.
So what are the red flags that tell you a sprain might not be something you can just walk off?
Yeah, so the most important thing for me is the ability to walk on it right afterwards. If you try and put your foot on the ground and you take a few steps and it feels like it's crippling pain, you can't put weight on it, that's a giant red flag for me. That's a red flag that you should get an x-ray, because one, you could have broken your ankle, and you should always rule that out first. Or two, if it's not broken, it's probably one of those higher end ankle sprains where you either partially tore or completely tore the ligaments on the outside. We got to get you immobilized a lot sooner. Those ones where you can walk on it afterwards, that's fine. It's a little swollen, it's a little sore. You can walk those off pretty easily with that rest, ice, compression. Whereas the ones where putting pressure on your foot's really agonizing, I wouldn't walk those ones off.
Okay, so you've rolled your ankle. What's the ideal next step? Ice, wrap, elevate, or call your local foot and ankle surgeon?
Yeah, so, going back to that spectrum of the injury, if you're able to walk on it, give it a few days. If it's feeling better, with that rest, ice, and compression, and perfect. It's probably not something you have to worry about, long term. It's those ones where, you can't walk right away. I'd probably get seen a little bit more urgently. Or if, after a week or so of doing those things we talked about, if it's not getting any better, I would definitely make an appointment to get evaluated, because sometimes we have to put you in a boot or a brace, something to allow those ligaments to heal up in the right position.
Yeah. I would also say probably if you are diabetic and you have neuropathy and you did an ankle sprain, you may not feel it. So in some cases, what might be a simple ankle sprain could actually be something a whole lot worse.
100%.
So what's one common myth or mistake people make when it comes to ankle sprains?
Yeah. I think, the biggest mistake you can make is trying to walk off on one of these horrible injuries where you completely tear your ligaments, you try and rub some dirt on it, you ice, you just kind of walk through the pain, especially my athletes that try and play through the pain just by taping up their ankle a little bit. Those are the ones that are really setting themselves up for some long-term issues where they have instability throughout their life, have multiple sprains, and can have worse injuries down the road.
Yeah, I've never seen rubbing dirt on something actually work very well.
No.
So it's amazing how many patients try to do that, though. In our next episode, we're going to talk about what happens when it keeps happening. If it's not just a one and done ankle sprain, but you keep spraining it over and over again. If this episode changed the way you think about ankle sprains, pass it along to a friend who's been limping for a little too long. Thank you, Tyler. You've been listening to the Foot Health Facts podcast. For more information on today's topic or any foot and ankle concern, head over to foothealthfacts.org. On behalf of the college, I'm Dr. Matthew Dairman. Thanks for joining us today. If you enjoyed this episode, don't forget to like, subscribe, and share it with someone you care about. Together, we'll keep everyone moving forward one step and one topic at a time.